Okay, Marilyn, are you starting us off as usual?
I am. Thank you very much. Well, we are fully expecting that the state is going to designate us as having met the metrics for moving into the orange tier. We'll have confirmation at noon today, but based on our review of the records and the data for the week ending the 24th of April, we appear to be meeting both the case metric and the positivity rate metric, and fully anticipate that by tomorrow we'll be able to reap the benefits of being in the next tier level, which does, for the most part, has increased capacity across various sectors. The soonest we could be considered to move to the yellow tier would be May 25th. And it would require, that gives us the full 3 weeks of being in the orange tier. And we would have to make sure that, we would have to be able to meet the yellow tier metrics for those last 2 weeks. And, we're hoping that we're going to be able to do that without any challenge, but it will obviously hinge on whether, there's always a potential for an unexpected outbreak. And so we will continue to monitor that. In the meantime, our efforts continue to be focused on vaccinations, and the state data right now, and of course, their data will show us, as we have, shared with your board before, will show us at a lower rate than we actually are when we add in our Toyabe data. But we estimate that our vaccination rate of it having at least one dose in the arm is at about 56.3%. And that's based on including Toyabe data that was provided on 4/21. So it doesn't include, any additional vaccinations that have occurred over the last couple of weeks. And that's within the 5% of the state average. And then our fully vaccinated is about 42.7%. So right in line with where the state is. So we are at par, at level with the state, but we have a ways to go. We still want to see that vaccination rate increase, and we are working on various outreach efforts, everything from department-wide, making sure that all of our staff are able to provide information and direction to the various people that we outreach to every day or come to us for services, and also outreaching to the faith community and other venues where we can help get the information out to the community, answer questions, and look at ways that we can do increase the rate of vaccines, make sure that people who might have some hesitancy are able to have their questions answered. And with that being said, I'll have Anna provide us the update on the vaccines specifically.
Thank you. I'll give an overview. We are continuing to have lots of appointments available within the community for vaccine. I'm just going to run down where all vaccine is still available in Inyo County. We do have Moderna vaccine specifically available right now at Northern Inyo Healthcare District, and we are making those appointments through the myturn.ca.gov website. So individuals who go onto that site and enter the zip code for Bishop, California, or search Bishop, California. We'll see those appointment slots opened up or available there. Right now, we're looking at Tuesdays for first dose clinics. So that's one opportunity we have in the Bishop area. We also have Valley Health Team, also in the Bishop area, offering Moderna. They're currently offering Monday through Friday, and they are offering by appointments by telephone. So to make an appointment with Valley Health Team, you can contact them at 760-784-7020. Southern Inyo Healthcare District, through their rural health clinic, is still offering Moderna vaccine as well, Monday through Thursday. And they are also taking appointments by phone. Their telephone number is 760-876-1146. We have Moderna available through Vaughn's Pharmacy. That can be reached through the myturn.ca.gov site, and also directly by searching online for Vaughn's COVID vaccinations. They use their own scheduler, so it's linked through both MyTurn and directly through the Vaughn's site for scheduling, and they are offering Monday through Friday. Dwayne's Friendly Pharmacy has started to offer vaccine as well. They have both Moderna and Janssen vaccine, and so they are taking walk-in appointments, but also have a portal available for registering. That's through, I'm sorry, this doesn't tell me what the name of the portal is. I'm gonna have to look that up and come back to that one. I apologize for that. We have a link on our weekly EOC update, and also we'll have that in our vaccine email link to be able to register. But again, they are accepting walk-in appointments as well at Dwayne's Monday through Friday. You also can call them and make an appointment by calling 760-872-2522. And then finally, Rite Aid is offering both Moderna and Janssen vaccine currently as well. They're offering Monday through Friday. I do believe they have some capacity to accept walk-in patients, as well as registering on the Rite Aid site. So there's a website where Rite Aid is also taking appointments, or by calling their pharmacy at 760-873-7883. Inyo County, in partnership with several other providers in the area, has done a couple of Pfizer-based clinics over the past couple of weeks. So April 24th and 25th, we did a first dose clinic in Bishop. We talked about that last week, provided vaccine to about 600 individuals. And then last week on Thursday, we were in the Lone Pine area and had 63 individuals come in for that clinic. So we certainly have the capacity to serve more people, but we are seeing, as we have these clinics and talking to people, assessing where people are hearing about it, finding that we have some gaps, trying to get information out and through every channel we can think of. But in the end, had a good number of people that we were able to bring in at the very end of the Lone Pine Clinic, just through word of mouth and hitting the streets. We had our former public health director, Tamara Cohn, was helping us out at that clinic, and she was walking down Main Street looking for individuals who were interested in being vaccinated. So appreciate all of the volunteers and partners that have been helping us get those larger clinics out in the community. We do have second dose clinics coming up for both of those in May. We'll be doing second dose Pfizer clinic on the 15th and 16th, and then back in Lone Pine on the 20th. So I just want to mention, because I've had a couple of inquiries, that individuals who've received their first dose and have registered through that MyTurn site should be getting email confirmations if they've entered an email address. And if they need to change their appointment time for their second dose, they can go back in through their confirmation email and click that link to adjust their time if there's a different time they need to come during those clinics. So I just want to make sure I mention that. We are monitoring at the at the federal level. There is a request based on some additional vaccine trial information that Pfizer has submitted to the FDA. We are waiting the potential for an expansion of the emergency use authorization for Pfizer to be able to administer that vaccine to individuals aged 12 through 15. So expanding to more of that teenage population. We don't have an estimated time frame for when or if that may be approved, but we are working with both at the state level through CDPH and then also locally with our current and potential for expanding our provider network. We do want to make sure that we have a series of opportunities, probably rather than doing these very, very large, super resource intensive mass vaccination clinics, looking for opportunities with this vaccine to get it out to more of our providers, given that we do have several providers in the area who are offering vaccines. So Pfizer, again, is fairly difficult to manage. We still have to keep that at ultra low temperatures. Some of our providers have been able to obtain ultra low temperature freezers. Inyo County is working on also doing that. So we will be looking to potentially act as a hub through public health to take those large, still get over 1,100 doses for each shipment, which is not really a manageable number for some of our smaller clinics. So we'll be looking to transition to be more of a hub to store and then get smaller amounts of that vaccine out in various ways. So working through the logistics of that in anticipation that we may be expanding eligibility even further to some younger teenagers. And I believe those were my main vaccine updates for today.
Okay, great. Dr. Richardson?
Morning, Board. I'd like to bring the board up on some future promising treatments that are being developed by multiple companies, including Pfizer and Moderna. The most immediate one is probably going to be boosters by Moderna and Pfizer, either annually or maybe even sooner. They're studying these and tweaking the vaccines to cover some of the variants. The other interesting and exciting event is there's going to be probably at the end of the year, they're in studies now, phase 2 and 3 trials, a new oral antiviral therapy. Pfizer and also Emory University is involved in that study. So there's going to be 2 treatments out there that you take, just like when you get the flu, you take Tamiflu at the first onset of symptoms. So the therapy is designed and hopefully will keep people out of the hospital. That may be released by the end of the year. The last exciting news is that they're producing a coronavirus vaccine taken as a pill, just like the polio virus is. So these are in clinical trial in the second quarter of this year. So hopefully that'll be available and be very helpful in controlling this disease. The issue about, I read, and maybe some of you read a lot about this coronavirus vaccine certification versus passports. There's a lot of chatter going on about that, whether or not it's going to be mandated, maybe not by the government. They say they're not, but private industry may be mandating it, and there's going to be a lot of activity around that. So that's my update for today.
Okay, thanks. Does the board have any questions?
I got one. I'm not sure how this can work. If one thing I wonder about is when you're down here in Lone Pine giving the second dose, what if, I mean, is it possible for people to come in and say, hey, I want my first dose at that point? I get it that you're not going to be doing a max vaccine clinic every 2 or every 3 weeks or whatever here, but is it possible for them to do that and then just schedule wherever they have to go to get that dose? So that's just a question.
Yeah, we are looking at that. I can't confirm that right now, but definitely we want to be able to expand so that if we do a clinic out of public health, there are some options if someone can't make it back to the second dose. That has been restrictive for individuals that just have other things going on and aren't able to get in if we don't have other opportunities for getting that second dose of Pfizer. So I do think that second dose opportunity could potentially expand over the next few weeks or into the summer months, where we can do more of those, you know, if we get people or capture them, especially out in some of the areas where we don't have regular availability, that we would be able to have other options for getting that second dose. So I'll circle back with my team, Supervisor Kingsley. We've talked about offering first dose again, and just need to make sure that we will be able to get back for that second dose if we don't otherwise have an option for people to get that second dose lined out in June.
Of course, as I'm talking, or as you're talking, I'm thinking this through. You could also just tell them to go over to the clinic, get their first dose there, and because they've got it, right?
Yeah, we definitely have a lot of Moderna in the community, so there's a lot of availability. It's really at this point the 16 and 17-year-olds, and potentially the younger teenagers that won't have as much access to vaccines. So it's thank you for pointing that out. We do have a lot of appointments available. We're starting to see some slowdowns in demand. Individuals who are 18 or older have a lot of opportunity to get in for a vaccine appointment at this point.
And part of it might be preference, whether they wanted the Moderna or the Pfizer. I guess that might make a difference. Because I don't think we have Pfizer at the clinic down here, right? It's only, yeah, okay.
And I just want to take the opportunity to plug one more time that if you are interested in vaccine, get the vaccine that's available to you as soon as you can.
Great. So I have a question about mule days in preparation. Are we in coordination with the state? Do we have any thing that looks like it's a roadblock or any issues that we should be aware of?
We received an updated plan from the Mule Days Committee that I'll be reviewing with my team members today. I've not heard any any roadblocks, so to speak, coming down from the state. I do know that the state is looking at, as we move beyond the blueprint, what types of guidance will be in place. So there's some discussion about potentially certain caps on very large events, but nothing that's been specifically brought up to us at this point. The plan currently is based on what the current guidance allows for, and so we're just checking in on some of the additional details that have been added and continuing to apply the guidance that's available right now.
Okay, yeah, I've had some communication with Senator Borges' office and asking if there's any way that they can help or any other way they should be advocating. But it sounds like we're good to go. Is that what I'm hearing from folks?
Yeah, I think there's some, I'm not totally involved in all of the different details. I think there's maybe some, from a public health perspective, we are reviewing. I'm not sure if there are any other approvals that need to happen at the state level through, my understanding is they've been working with state fairs and others, and I'm not aware of any other roadblocks, but we're certainly continuing to look through the details as the plan continues to evolve and become more detailed, and making sure that we're applying guidance there.
Yeah, Mr. Chair, I'll just add on to what Anna said. I think public health has been fulfilling its role exactly and exceptionally as it should, which is in an educational and assistance role. So I think that's been most evident. And with regards to roadblocks, really there aren't per se roadblocks. I think really what's going on now is because the fairgrounds is a state facility, there are considerations for permitting and whatnot that have to be considered maybe outside of the public health realm, but because of permitting, which comes through the state fire marshal's office, there's a number of things they're wanting to see. So those those are the, I guess, if you want to call it roadblocks or just issues, challenges that are being worked through, but it's not really coming from a public health perspective. I think public health has been providing exactly what's been needed. So it's maybe a different structure within the state than the public health realm. But related.
Okay, well, Jen, then I may just CC you on the response that I have with Senator Borges's office. That way, if they have any more details, you could help us out with that. Okay, I noticed that these sessions are getting shorter and shorter and shorter, so hopefully that's good news for everyone. Thank you so much, and let's keep trying to get the word out, get as many people vaccinated as we can.
Great job, guys.
Thank you. Bye-bye.